Good morning, Cassie. Johnny, how are you this morning?
Doing well.
Good. Well, welcome to today's team meeting. We're going to look at some specific cases, but first I want to talk to you about discharge planning. How do you decide or help your clients decide when it's time to meet less frequently or discharge completely from counseling?
Usually I know when they're ready. Either they tell me they're ready to be done or they just stop coming. Basically, I need to know that they've made progress through therapy.
Mm-hmm.
I mean, yeah, that's what I do too.
Okay. Well, that's a good start. You also might want to think in more concrete ways about discharge planning. Have you looked at your ACORN data recently?
I haven't, but I go through the form each session and talk to my clients about it.
The same with you?
Yeah.
Okay. Well, that's a great first start. But research actually shows that clinicians who look at their data regularly tend to have better outcomes in treatment. And part of the reason for that is that clinicians tend to have a lot of empathy for their clients, and that's great when it comes to developing the relationship with the clients. But when we experience a lot of empathy for someone, we're more likely to see things as going really well and positive. And we're less likely to know when problems are happening or things aren't going so well. So it's really important to look at the trends and look at your data. It may show you issues that have come up that you weren't aware of, or it may just confirm that things are going well like you initially thought.
Okay.
So let's take a look at a specific case. Is there one that you'd like to look at that you think is going really well?
Yeah, actually, if we could look at Andrew here, his client ID is 560097.
So if you've never logged into the toolkit before, search your old emails and you'll find one that has your username and password on it. What I do is I bookmark the login page, and that way I don't have to remember the web address. And the web address will also be in that same email. So I'm going to log in right now and we'll look at something. Okay, so once you're in, you can either type in the client's ID number that you're looking for here, or you can scroll down and find the ID number within all the clients who have completed ACORNs in the last 2 months. You can change the date range here if you want to narrow it down or expand it. Now, if you click on the client's ID number, it'll take you to their specific graph, and this will bring up Andrew's graph. This black dot, can you see, Johnny?
Yeah.
Here we go. This black dotted line here is the average score of the questions on each ACORN, except the substance abuse and alliance questions. A 0 here is like never, while a 4 is like always on the form. So lower scores indicate less stress, and ideally we want to see this black line going down. The purple line is the average score of matched cases based on age, diagnosis, gender, and other demographic variables. We can see how a specific client compares to people like them. The green line here is the point below which adults not seeking mental health services tend to score. So it looks like Andrew has made great progress in the 7 sessions you've had together. He's doing better than clients like him. See how the black line here is below the purple line? And the fact that his average score has been below this green dotted line here is a sign that he's done very well. Actually, let's check the clinical message. Okay. It says this patient reports significantly greater than average improvement, and the global distress score is at a low level of distress comparable to individuals in a community sample who have never sought mental health services. There are no other risk indicators. This appears to be a very good treatment outcome. Patients showing this pattern at this point in treatment are often ready to terminate or need to be seen less frequently. Additional sessions tend to not result in further reduction in stress.
Wow, so maybe discharge is something we should look at.
It might be. Has anything happened in the last couple of sessions that make you a little nervous to talk to him about discharge?
I can't think of anything, but we seem to make such good progress every time we meet. I kind of wanted to keep that momentum going.
And if you did, where do you think that momentum would take you?
Towards making Andrew a happier person, I guess.
Well, it looks like, as we take a look at the data, that he really is doing quite well, and that we should think about spacing out the sessions or discharging him completely. Because as you know, there are a lot of people on the waiting list that have really critical and immediate needs that are really desperate to get into counseling. And if we freed up your caseload a little bit, we'd be able to bring some of those people in.
Yeah, that's true.
Now, one of the nice features of the toolkit is that you can actually see in ACORN which clients have more critical and immediate needs instead of trying to guess who they are. There's all sorts of data in here that can help you make clinical decisions. It won't dictate how you operate clinically, but it's information that you should and could use. Okay, let's bring up the main toolkit page. See here, this is a list of all the clients who have completed ACORN forms in the last 2 months. You can change the date range, but it defaults to this so that you can see your active clients. If you scroll down, you'll see your clients. This table is automatically sorted by how well the client is doing compared to their expected change and brings the off-track folks to the top. See here, client 27351. It's flagged as off track. Whose is this?
Oh, you know what? I think that's Emily.
Does this surprise you? Did you know that she had been getting worse?
It's a frustrating case. I'm really not all that surprised by the graph. She's been having a lot of drinking issues and she's not been taking her meds regularly. And to top it all off, she was told last week that she's being evicted and she needs a new place to live. So there's just a lot going on right now.
Sounds like it. Okay, let's click on substance abuse and the self-harm domains. If you take a look at this, you see it's definitely something to follow up on. You might want to give her a call today, actually, if you haven't talked to Emily about her suicidal thoughts recently. Look, her suicidal ideation here has been increasing with spikes, and her substance abuse has recently spiked. This really concerns me.
Yeah, it concerned me too. At her last session earlier this week, we talked about her suicidal thoughts. Once she fills out her ACORN, I look at it and I can see that she's had some thoughts about hurting herself. She understands that when she starts drinking, the risks of hurting herself gets higher. So we reviewed her safety plan and it's up to date and she's scheduled an appointment to come in tomorrow.
That's really good to hear. So it looks like Emily has also been giving you feedback on the ACORN that she's not totally in agreement with where treatment is heading. Let's take a look at these alliance questions at the bottom. Have you talked to her about this?
No, I didn't really know what to say.
Well, I'd start by asking her what's not working for her. Ask her what's really important to her that you haven't been talking about. Ask her if something's missing from her treatment plan or something that she doesn't like is going on. And also ask her why she only feels somewhat respected by clinicians and other clients here. This is great feedback she's giving you, and it might really help her treatment progress if you can address some of these issues.
All right, sounds good. I'll be sure to ask her tomorrow.
Okay, and Cassie, remember to always thank your clients for the feedback that they give you on these alliance items. To me, these scores are never a reflection of you as a clinician, and I'll never use them to evaluate your performance because they only tell us how a particular client felt at a particular session. The feedback is important to you, and what it tells me when I see them completed is that your clients feel safe with you and respect you enough that they've completed these items. So that's a great thing, and be sure to just thank them for it.
Okay.
And how has the ACORN process been going for both of you? Is it working to have your clients fill out the ACORN in the waiting room? And are you putting the completed forms in the ACORN box by the fax machine?
You know, it's working fine for me. Actually, like what you said, I've been thanking my clients more and explaining to my new clients what they are filling out. And since I've been doing all that, I've only had one or two refused the form.
Terrific.
Yeah, I mean, it's been working fine for me too. I just assume that it's being taken care of because once I drop them off in the box at the front desk, I don't hear anything about it. So.
Okay, that's good to hear. I'll touch base with the reception staff to make sure it's working for them too. They should be monitoring to ensure that all your faxes are received and properly processed. And please let me know if you run into any problems, because I really want to make sure this process runs smoothly for you.
Will do.
Okay.
Okay, let's review some more cases.
All right.